As men age, it's particularly important to not only recognize the signs that your body may be in need of some attention, but to preemptively strike any common ailments before they get serious. Joining us on more men's wellness is Dr. Lucinda DeMarco, Chief Medical Officer for United Healthcare of South Carolina. Great to see you.
Good to see you as well, Leyla.
And this goes for all of us, an annual wellness check. We all need this, but for men, they're not necessarily the ones to run out to the doctor anytime soon.
No, they are not. And in fact, I think sometimes the younger they are, the worse it is. Our young adults, the 20, 30, 40-year-olds say, I'm healthy, I don't need to go to the doctor. And really, to have a good long life of good health, you do need to go to the doctor, and you should go once a year. You may not need to go more than once a year, but you should go once a year. And, when you go, the doctor can do blood work. They'll do a physical exam, take a history. So it's really important to trust your doctor and tell them the truth about what's going on with you.
And talking about that critical age bracket that you just mentioned, 20s, 30s, 40s, 50s, what are some of the most common ailments that men can find themselves susceptible to?
Well, it's kind of, I call them the classic triad, if you will. We worry about heart disease, which can affect anything with the heart. We worry about strokes. We worry about depression, especially now coming off of COVID. We realize that depression is really something that people are not necessarily comfortable with, and it's kind of had a stigma associated with it. And so we really and truly want people to be comfortable discussing those kinds of things with their doctor. And when you're dealing with men, you have to worry about men's special parts. And so prostate cancer is another big one, as well as other types of cancer.
What about testosterone? As testosterone becomes depleted over the years, what are your thoughts on testosterone replacement therapies? Is it a good idea? Does this help with any of these potential ailments?
It's just like women replacing estrogen. It can help with some of that. The thing that you have to be careful about these hormone replacements is it affecting your blood pressure? Is it affecting any of the other things that will put you at greater risk for those diseases we just mentioned? Because when you're looking at those risk factors, you're looking at an older age, you're looking at family history, but also high blood pressure, diabetes, high cholesterol, obesity. All of those things affect all those diseases, plus many, many more. And so sometimes you have to play the tightrope of weighing the good risks and the bad risks to decide what you need to do.
And we often refer to this as common sense. However, are there any list of things that men can do to implement in their everyday lives to make sure they stave off some of these ailments?
Well, first of all, besides going to the doctor once a year for a checkup, which we're all assuming they're going to do, the big things are really to eat a good, healthy diet, lots of fruits, lots of veggies, which are not things any different than we've always talked about, lots of water, stay away from the juices and the high sugar things. You want to do complex carbohydrates, such as your fruits and your vegetables, lean meats, fish. All of those things can help your body be healthier, and exercise. And exercise doesn't have to be any more complex than going for a walk, and anybody can do it. And you don't have to go outside. It's getting hot and humid, and people don't want to be outside. And so the thing to do is really walk in your house. You can walk from the kitchen to the bedrooms and back again, and do that several times. And gives you exercise.
Absolutely. And also, let's not forget telemedicine. So if you don't have the time to actually go to the doctor's office, you can always ring them up on the phone, do a video chat. There's myriad ways that people can make sure that they're taking care of themselves. I want to thank you so much, Dr. DeMarco, for joining us today.
Thanks, Leyla. I appreciate it. And everybody stay healthy.
Stay healthy. We're back after this.